I actually worry about people that have absolutely no fear of a major operation like this. This is a significant undertaking, and you know, it's reality testing. People should consider this seriously.
It's natural for a patient to be fearful of the unknown, especially of surgery. We're taking something out of your body and putting something artificial in it. It's a big deal for a patient to make this decision. Throughout life, with biology specifically and surgery, there is always going to be things that we can't control. This system allows us to control the uncontrollable in a very precise way.
You know, robotic surgery, the Mako plasty system, gives us a major tool to do a very precise job and obtain reproducible, excellent results. Again, it is something that people have to think about. They have to understand their situation, and they have to really want to change their life and regain their function. Pain's a terrible thing to live in. Fear of a surgical procedure is appropriate. That said, the most frequent complaints that I get after this type of surgery and after rehab is, geez, I wish I didn't wait so long to do it, and I'm not going to wait nearly as long to get my other side done if they need it.